Hi guys, welcome. Thank you for joining us for our weekly media brief. Today we will be talking about a few things going on in the city. First topic is our library. The Wichita Public Library invites residents to celebrate National Library Week. That will be from April 19th through the 25th. National Library Week is a national observance sponsored by the American Library Association and libraries of all types across the country each April. It highlights the valuable role libraries, librarians, and library workers play in transforming lives and strengthening communities. This National Library Week, residents can show appreciation and support for the Wichita Public Library virtually by visiting wichitalibrary.org, following along on social media, and using the hashtag National Library Week. While the library's physical spaces are temporarily closed due to COVID-19, residents can still discover ebooks, e-audiobooks, databases, and other online resources by visiting wichitalibrary.org. So I'd like to introduce our partners over at the United Way, who are going to discuss housing and community service and some of the stuff that they are partaking in. They are, just a personal note, is when this thing first started, we had to make plans for the COVID-19 and the path forward. The United Way was one of the first people I called, and they came and with their leadership team and just absolutely took this on head on, and they've been an amazing partner. Their number is 211 for those who are looking for any type of services from the nonprofit sector, and we're just really glad to have them on our team. And Chance, glad you're here. And without further ado, I'm going to introduce the Housing and Community Service Department Director, Sally Stang, and also Dr. Sanders, who is the head of the Continuum of Care for United Way, so they can help us get an update on some of the services being performed for our most vulnerable populations here in Wichita. So, as you approach, I'll walk backwards.
Well, thank you, Mr. Mayor. I'm Sally Stang, the Housing and Community Services Director for the City of Wichita. The City of Wichita has an active role in the community's fight to end homelessness, and I'm going to talk a little bit today about what the city does on a normal basis in this fight, and then add on at the end we're going to talk a little bit about our response related to COVID-19. So we are blessed to be proactive in this battle. We have the Wichita Police Department's nationally recognized homeless outreach team who responds to 911 calls related to homelessness, and whose goal it is to connect people to resources rather than jail. We have another innovative program is the city and county partnership funding and the administering of the Housing First program. Using almost $400,000 in general funds from the city and the county combined, the Housing First program provides housing assistance coupled with case management and wraparound services to house the most chronically homeless individuals in our community. Since its inception in 2009, the Housing First program has housed 343 chronically homeless individuals. In addition, through the Housing and Community Services Department, the city provides $238,000 in federal emergency solutions grants funding to fund 7 local homeless shelters, 2 agencies providing rent and utility assistance to prevent homelessness, and provide short-term rent assistance through the Rapid Rehousing Program. As the ESG provider for the community, the city participates on the Continuum of Care, which is the local planning body of the community to coordinate housing services funding for homeless individuals and families, and it is the group that's responsible for applying to HUD for Continuum of Care funding, which equated to almost $2.7 million in 2020. In the Wichita Housing Authority division of the Housing Department, we administer 308 Veterans Affairs Supportive Housing Vouchers in partnership with the Robert J. Dole VA Medical Center. This program provides over $1 million in rental assistance specifically for homeless veterans in our community. And effective January 1st, 2020, the City Council approved a limited referral-based homeless preference in the Housing Choice Voucher Program for up to 10% of the city's allocation of vouchers. This resource provides an additional $1.85 million in housing assistance for the homeless who have case management and other services provided by homeless service, mental health, medical, and substance abuse agencies in the community. In January, under a move-on strategy, the Housing Authority began accepting referrals from permanent supportive and transitional housing programs, and on February 7th, the Housing Authority began accepting referrals from the Continuum of Care agencies for any of the 165 individuals on the by-name list of literally homeless individuals and families in our community. Since January, though, we've received less than 30 referrals, demonstrating the gap in our community is lack of case management more than it is a lack of rent assistance. In response to COVID-19, the city has been collaborating with the Continuum of Care to plan the emergency response to COVID-19 in the homeless population. The city has assisted by evaluating the use of the old downtown library for an emergency shelter or isolation area. Following discussions with the health department and the fire marshal, it was deemed that the use of the library would not provide adequate isolation. Therefore, the city is working to fund $300,000 in motel vouchers through United Way of the Plains to temporarily shelter symptomatic homeless individuals awaiting test results or those who test positive. In addition, the city is funding Humankind Ministries to keep the winter shelter open through the end of April on a 24/7 basis. The city's received over $850,000 in additional emergency solutions grant funding from the Coronavirus Aid, Relief, and Economic Securities Acts. These funds will be used to fund the shelter and the motel vouchers, and the city is collaborating with the health department and the Continuum of Care to identify gaps and needs to protect the homeless during the outbreak. Dr. Luella Sanders is here from the United Way of the Plains as a representative of the Continuum of Care to report on the Continuum's activities developing the COVID-19 emergency response plan for the homeless. Luella?
Maintain that. Thank you very much. Would like to thank the mayor and Ms. Stang for giving us the opportunity to highlight the community work in the Continuum of Care. That United Way of the Plains is the lead organization for the Continuum of Care. It's just one of many ways we're able to help mobilize resources to address community needs. In this case, the Continuum of Care, as Ms. Stang said, is to coordinate the homeless crisis response system to prevent and end homelessness as a goal. So the COC, which is, you might have heard it for either Impact ICT COC or the Wichita Sedgwick County Continuum of Care, but more frequently you'll hear it as the COC, is a coalition of housing and homeless service providers, of other nonprofits, of churches, of state and local and federal government representatives and businesses and community advocates. It's an open coalition. Anyone who would like to participate and be involved in that year-round process of coordinating that crisis system is welcome and would be appreciated. 2 months ago, the Continuum of Care developed a emergency response, emergency preparedness plan for COVID-19. And it has evolved. It is still, those strategies and implementation ideas are still very fluid, but the three goals that are the foundation of that plan remain the same. One is to keep the residents in those emergency shelters and the staff at the shelters safe. The other is to maintain operation of that system so that we have shelters available when needed. And thirdly is to secure housing for as many people as possible so that they do have a place where they can self-quarantine or isolate as if needed. So one of the first things we did was reach out to local experts and also to other communities that unfortunately have had experience in implementing strategies to address COVID-19 among the homeless populations. We have listen to their things that were successful in those communities and also the things that they would do differently. And we've incorporated that input into the plan. Shelter providers have made Herculean efforts to adapt the shelters to be compliant with CDC guidelines of social distancing, hand washing, and the other. But it also is not going to succeed if it's only the shelter providers. It really does take community involvement, and it takes leadership in public-private partnerships. And so really would like to acknowledge and thank the mayor, the city council, the leadership and staff of the Housing and Community Services Department especially, and the Board of County Commissioners, the leadership and staff of the Sedgwick County, and especially that Emergency Management Operations staff, the Public Health Department, and the VA. All have been involved and very strong leadership and input into that plan. And as it continues to develop and it continues to be implemented. If anyone is interested and would like more information about the COC plan, the coronavirus, or the want to screening for COVID-19, as the mayor said, they can call 211 United Way's Information and Referral Line to be connected to resources and information. Thank you very much.
Again, I just want to thank our partners for coming over and talking about what we're doing to help the homeless population. As mayor during this time, I've received a lot of input and a lot of questions about what we're doing as a collaborative effort with the nonprofit community, with the county, and with the city to address the needs of our homeless population. I just really want to thank you guys for coming out here and being willing to be a part of the press conference. So with that, I also asked my colleague over at the County Commission, Commissioner Cruz, to come over and talk to us about addressing another critical service for our community, particularly at this tough time, and that's mental health. So she will also be joining me on our Facebook Live with Michelle Calvert, who's the Director of Quality and Strategic Innovation with ComCare of Sedgwick County, which will be happening, I believe, at 2 o'clock, pending if the governor does hers at 2 o'clock. So with that, I'd like to welcome Commissioner Cruz to the podium, and she can discuss what they're doing as far as mental health. Thank you.
Thank you. It's nice to be out in the sunshine today. The COVID-19 pandemic has changed the way we communicate with all of those around us, and I know it's very difficult for a lot of people right now. With that in mind, I want to remind our community that resources are available if you're feeling stressed or need to reach out to somebody. There's no right way to feel right now. Please reach out. ComCare provides a wide array of behavioral health services to adults and children in Sedgwick County. Target populations include children with serious emotional disorders and adults with a severe and persistent mental illness. These populations are eligible for rehabilitative services that occur primarily in our community. Crisis services, including mobile services, are available to assist individuals with urgent behavioral health needs and are provided 24/7. ComCare is still providing services to residents and patients through telehealth and other avenues. Right now, residents may call the support line if they feel like they're experiencing an elevation in mental health symptoms. There are a couple of numbers to call. Individuals may call 316-660-1111 from 7 a.m. to 7 p.m. Monday through Friday. They'll receive resources that are about coping skills, encouragement to keep doing what you're doing to stay healthy emotionally and physically. Residents who are experiencing mental health crisis can also call 660-7500. A couple of other things that I want to talk about. As reported by John Hopkins this morning, Kansas has 1,562 cases of COVID-19, and Sedgwick County has a total of 211 cases. In Sedgwick County, out of those folks, 86 people have recovered from COVID-19 and 3 people have died. This is still an evolving disease, and as more information and recommendations come out, we will share them with you as soon as we can. Please follow us on all social media sites, Facebook, Twitter, and Instagram for the latest news and updates. Remember to check back to the county's website as we work to keep this information as up to date as possible. SedgwickCounty.gov is where you can find that. Also, just yesterday, we're happy to report that the county has provided a dashboard that is live right now that has additional data points that become and are more detailed as numbers become available and as the cases of COVID-19 increase in Sedgwick County. I am so proud of our employees who are working to keep this community safe, healthy, and supported every day, and we are all trying to manage our daily lives as best as possible. I cannot reiterate the fact that the county employees that are working on this are doing it all day, every day. That's what we're working on to make sure that the residents in Sedgwick County stay as safe and healthy as possible. Our community will only succeed if we all work together to reduce the spread of this disease and follow the recommended actions like staying home, practicing social distancing, and keeping 6 feet distance from those between you. Washing your hands as often as possible with soap and water, covering your nose and mouth when you cough or sneeze, and limiting public gatherings to 10 or fewer people. One last thing that I want to report. Yesterday I had a lot of questions about how to spend Small Business Administration money coming to those small business owners. Next week, Councilman Johnson and I are working to work with our federal partners. We've reached out to Senator Moran's office to see if we can get him on the line. We know that it's very confusing, and we want to make sure that we don't add any stress. There's a lot of money that's out there, but spending it correctly, I think, is one of the biggest questions that people have, specifically for me. And so I'm doing the best that I can, and I just want to let you guys know to reach back out. Please keep checking out online to make sure when that's coming out. We'll try to be as communicative as possible to make sure that you guys understand that we want to get you the most information. I think when there's a lack of information, people fill in information with things that make them feel better, which isn't always as most accurate as possible. Please keep doing what you're doing and reach out as if you need help, because help is available. One thing that I wanted to do this year was, and continually, is reduce the stigma of mental health. And I know it's not easy to reach out when you need help, but please make sure that you know there's help available. And I'm happy to answer any questions that I have, or that you guys have. So please know that we're here, and we're here to help you. Thank you.
So, with that, I do want to just repeat some information that's already out there. We know that our stay-home order has been extended by the governor until May 3rd. If the deaths for the coronavirus here in the United States stopped today, if we had no more deaths after today, this crisis is comparable of adding up all the deaths from 9/11, Pearl Harbor, and Katrina, and then timesing it by 4. It is 4 times that. And in each one of those terrible, historical, tragic situations, our community has come together to support each other. So although it's getting tough right now when it comes to support of the stay-in orders, when it comes to figuring out how you're going to get through the next couple of weeks, we're asking that, just like with every other crisis that we have faced as a nation, to still not let up on the gas, stay focused on this, because we can get through this together and we can be that model community. And we know it's tough, but we also know, sadly, that the projections that the governor reported yesterday, both internally and the public data, suggests that this thing will spike or reach its peak in the next 15 days. So right now, even though it seems the hardest, we need people to really buckle down and focus on the stay-in orders if we're going to protect not just ourselves, but also our neighbors. With that, I'll open up to questions about what I've reported on, and also be happy to give the microphone over to our our friends who are working diligently to help our homeless, and also, of course, to Commissioner Cruz. Questions?
I know we're not there yet, but talking about reopening, has the city discussed anything about reopening?
So, of course, the question was, thank you, has the city been in discussions about reopening? To be honest, we are in the passenger seat when it comes to the stay-in orders that are done here locally. So the county is actually in a driver's seat. We play a supportive role. So with that, I could give the question over to our county commissioner.
Thank you. I think there's a lot of things that we have to consider when reopening. Right now, we're kind of under the governor's order, and so hopefully within the next couple of days, next couple of weeks, maybe we'll have some information about how the state plans to open things. But there's a lot of information out there. I think there's one article that I read that was shared to me. There's kind of 4 characteristics. Can we test people? Can our hospital systems handle the amount of people? Can we identify those who have been infected with this disease, who they have had contact with? And then do we see the levels of positive tests going down over a period of time? So those are some of the things. But in addition to that, I think we have to look at all sorts of things as far as our businesses and our mental health issues, those kinds of things. But from a COVID-19 standpoint, I think those 4 characteristics, among a few others, hopefully will provide guidance to how we will plan to reopen it. Whether it's an all-in-one shot or whether it's a tiered approach is probably the best way. But like I said, we'll have to look to our governor as far as what their plans are to reopen.
Other questions? Opening the floor for questions.
Commissioner Cruz as well. Has there been any talks about extending the Southern County, obviously, stay-at-home orders that expires next week, I believe?
Well, right now the whole state's under the governor's order, so we, that supersedes us, and so we had a discussion yesterday. But like I said, I mean, it's really, we're under the state's order right now. Yeah.
Other questions? Chance. Has Wichita had any cases currently in the homeless community?
I'm not aware of any. We have had some folks that were screened, but I'm not aware.
So is that accurate? So the information I've received, and the reason why I turned to my colleagues is because this was last week, and as everyone knows, this thing evolves, is I think there were at least 2 homeless people who are part of our homeless population who showed symptoms and were put in, we put them into hotel rooms, and I think either they got tested or they were tested, and those tests were negative.
I have not received.
Okay, we have no indication that they weren't negative. So right now, if members of the homeless population are showing signs, we do have I think it's vouchers in place to get them the ability to be isolated and monitored and get the medical care they need. Other questions? You guys have been great. Thanks again to the media for passing out good information that is saving lives. We're doing everything we can. I wish we could legislate this virus away. We can't, but our focus is keeping our community safe above all else. And we will get through this. We will be stronger on the other end. We have done it before in the past when we faced these type of tragic national situations. So please bear with us. We know it's hard. Let us know if there's anything that I can do. Please reach out to me, as well as my colleagues. Thank you.